Hi Anastasia, my name is Dr. Lux and I'll be doing your medical checkup today.
Hello Dr. Lux, thank you.
Thank you for coming in as well. Very nice meeting you.
Likewise.
And I see here that you sent over your chart from your previous doctor. Okay, let's just verify some brief information about you. May I please have your first name and date of birth?
Yes, my first name is Anastasia, and my birthday is February 26, 1999.
Wonderful. And when was your last checkup, Anastasia?
It was about 6 months ago.
Were there any abnormal findings during that?
Then everything was fine, but lately I've been having some insomnia that started about 3-4 months ago, some headaches that came with that as well. I've been having trouble falling asleep and been having some fatigue also.
Okay, I'm sorry to hear that. You mentioned insomnia, fatigue, headache. Can you localize your headache?
It's mainly in the front and the top middle area.
Okay, is it okay if I touch you?
Of course.
So front and then towards the top, medium. Okay. And did the headache and the insomnia begin at the same time?
No, the insomnia started around 3-4 months ago, and the headaches followed a few weeks after.
So the headaches followed. Okay. Have they gotten worse or better, or have the symptoms stayed the same?
They've been mostly the same. Sometimes it's actually pretty okay for a few days at a time. It gets worse at night when I'm trying to fall asleep.
Okay. So worse at night. On a scale of 1 to 10, how bad is the headache?
Sometimes it's around 8, so it's usually around a 6, I would say. I've also been having some heart palpitations too, like some dull pain in the heart area sometimes.
The pain, how bad is that on a scale of 1 to 10?
Right now, probably around a 3.
Do you feel it right now?
Around a 2, 3.
Okay.
And I have some feelings of like electricity in the heart area and like a fast resting heart rate when I'm trying to fall asleep sometimes.
Do you feel like you're easily running out of breath when you walk up a stair?
Sometimes, yeah. More than it used to be.
Are you on any medication?
No, not at all.
Any allergies?
Yes, I'm allergic to strawberries and peaches, but it's not too bad. Usually my face just gets red and my throat gets a little itchy, but it's nothing too severe.
Okay. And you mentioned the insomnia. So how many hours do you say you get to sleep at night?
I fall asleep pretty late. If I can sleep in, I think I can maybe sleep around 7-8 hours, so it's not that bad. But I usually have to wake up early, so maybe like 4 to 6.
4 to 6. So that's on a bad night. Okay. Do you have any medical history I should be aware of? Anything in your family, mother's side, father's side?
Yes, my mom used to have anemia in the past.
Okay.
And then on my dad's side, his mom had hypertension and diabetes.
And diabetes. Do you know if you have any hypo or hypertension?
Not as far as I know. I think I'm okay.
Any changes to your vision?
My vision itself is fine, but sometimes I have this kind of like watery eyes sensation, like I have sand in my eyes, but the vision itself is fine.
Okay. And when was your last eye exam?
Like a year or two ago.
1 year. So more than 1 year. Okay. Any changes to your hearing? Any ringing in the ears? Any loud sounds that are...
I do have ringing in my ears sometimes at night, but it's not too frequent though.
Okay. And does that come at the same time as the pain?
Yeah.
The head? Okay.
Not always, but usually it's at the same time.
All right. Any difficulty breathing?
Mostly fine, but I do get lightheaded sometimes. So sometimes it comes with shortness of breath, but it's not that bad.
Okay. So I'll go ahead and do a full medical checkup for you today, and we'll focus on your cardiovascular symptoms and head, eyes, ears. And hopefully we're going to get to the bottom of what has been going on with you. Are you following any particular diets or anything?
Nothing too strict. I just try to eat healthy, try to eat lots of veggies.
Good. So you're not vegan or not following the keto diet or anything? Okay. Sounds good. So I'm going to go ahead and set down the chart and put on the gloves. And I'll begin by taking your vital signs.
Thank you.
And do you have any pain right now?
Just in my heart area. I had a bit of a headache on the way here, but it's mostly gone away. So let me listen to your heart and lungs.
And is it okay if I slide this inside your shirt?
Go ahead.
Go ahead and breathe normally. I'm listening for any murmurs, any abnormal sounds from the heart. I'm going to listen with the bell side as well for the more superficial sounds. I'm able to hear S1 and S2. No extra sound. Heartbeat is a little on the low side. Not hyperdynamic, but definitely on the lower end. Okay. Let's check your lungs too. Take a deep breath in and out. Good. Deep breath in and out. Good. You can just breathe normally now. I'm also going to check your carotid artery. No bruits. Good. Okay, I'm going to set this aside and just go ahead and check your oxygenation. So this is going to go on your index finger, and you can rest this right here. And I will check your pulse, and I'll start again by your carotid artery. Checking it manually too. Good. And over your brachial artery. Checking the character of the pulse. Good. And by your wrist. Wonderful. 99% oxygenation, and just like I heard, the heart rate is a little bit on the lower end. Are you athletic? Do you exercise regularly or sports?
I play tennis a couple times a week, and I'm just getting back into weightlifting around 3 times a week for now. And sometimes I go for a run or a walk.
Okay.
That's mostly it.
Heart rate was about 60 beats per minute, which is consistent with an athletic type body. But I didn't hear any extra sounds. No hissing in the lungs, no adventitious sounds, so no bronchitis, pneumonia, and all the heart sounds were normal. So I'm not concerned. And let's go ahead and check your temperature as well. Any flu-like symptoms?
No.
All right, 97.5. So temperature is normal. Let's go ahead and check your blood pressure. Have you had this taken before?
Yes.
Okay, so you know what to expect then. I'm gonna go ahead and set the chart over here. And is your right arm okay? Good. Let's put the cuff nice and snug around your arm. Good. And the sphygmometer over here. I'm gonna go ahead and close the valve. And legs are uncrossed. Go ahead and just relax. Good. So blood pressure on the low end of the spectrum here, 95/60. Are you dizzy right now?
Not right now, but sometimes I do get dizzy and lightheaded. But I'm okay right
That may just be normal for you, especially if you're working out a lot. So let's go ahead and make a note of that baseline. 95/60. Normal temperature. Normal heart rate, a little on the lower end. So I'm going to go ahead and just look at your physical appearance first. Checking for any skin rashes, any external immediate signs of any underlying conditions. You can just relax. And I'll start with your face. Checking the overall appearance of the skin. Checking your chest for any abnormalities of the skin. No bruising, no blue or purple colors. Neck looks normal. Let's check your arms too. The inside of the arms. That's normal. And your left arm as well. Good. Now go ahead and keep your eyes closed and tell me if I'm touching you on your right arm or your left arm.
Right. Left. Right. Left.
And now the left or the right side of your chest.
Right. Left. Left. Right. Left. Right.
Okay. I'm gonna go ahead and tap on the bony prominences of your body, and I'm looking for any abnormal neurological reactions. So let me know if you feel any pain.
Okay.
Starting with the top of the head.
I do feel some slight, like dull pain, some discomfort.
Okay.
A little bit.
Okay. How about here?
It's around the same there.
On a scale of 1 to 10, how intense is it?
It's only around a 3, 4.
How about on the side of the head here? Any pain there?
No, everything's fine.
And here?
Everything's okay there too.
Okay.
I feel some like pressure, discomfort, but it's okay.
Okay, how about here?
Everything's fine there.
And on the chin?
Everything's okay.
Good. Checking for the eye reflex. Good. Present. And how about here? Any pain there?
No pain. No pain. No pain. No pain. No pain. No pain either. No pain. There's a little bit of pain there, but it's mild.
Let's turn that again.
It's like around a 3, I would say. Not too bad.
Any pain there?
No, just when it was higher.
Okay. So around your clavicle.
Mm-hmm.
Go ahead and palpate. I'm gonna check your lymph nodes. Sometimes swollen lymph nodes can be the size of a small cherry. I'm not feeling any inflammation or elevation here. So, supraclavicular lymph node is fine. Let's check the other side too. Okay. Yeah, no inflammation. I'm gonna check your lymph nodes on your neck as well. Cervical and deep cervical lymph nodes are not inflamed. Checking the occipital lymph node in the back of the head towards the spine. Good. And the preauricular in the front of the ear, posterior auricular. And the submental and parotid. Good. No elevations noted. And checking your thyroid. Trachea is midline. Thyroid gland is barely palpable. Okay, I'm also going to palpate your head and apply slight pressure to the sides and to the front. Let me know if it's too much.
I do feel some pressure on the front and back a little bit.
Checking for any elevations or asymmetries. So pain in the top. How about the back? By the spine here at the top of the spine. Any pain there?
Not so much pain, but I do feel more like a pressure sensation there. Mainly discomfort, but it's not very painful.
Okay, the head is symmetric and I'm not feeling any bumps. I'm gonna go ahead and use my comb here to just check the strength of the hairline. I'm not seeing the strands of hair breaking. So no abnormal hair loss. And checking the scalp. Okay, no dandruff. Hairline looks healthy. Scalp looks to have a normal color appropriate to your ethnicity. No signs of alopecia and no abnormal hair loss. We go ahead and check this other side as well. And look over to your right. That looks normal. Let's go ahead and check your ears next. You mentioned some ringing in the ear. Is it the left ear or the right ear?
Usually my right ear. Sometimes it feels like it's both, but usually my right.
Okay. Any pain associated with that or just the ringing?
Just ringing and like some pressure. And maybe like pain on a scale of like 1 to 2.
Okay.
But nothing too bad.
All right, let's go ahead and take a look here. And you can move your head towards your left side. Good. I'm gonna take a look on the outside first. See if I can spot any discharge or any redness. And I'm not seeing anything. Oracle of the ear appears normal. Okay, let's take a look inside. I'm able to visualize the tympanic membrane, and you have a very tiny ear canal. I do see a little redness, and what appears to be the beginning of a ear infection. Some slight wax build-up, but within a normal amount. Okay, let me make a note of that. And we can try treating that with some antibiotics. So right ear presents wet discharge and redness, but normal tympanic membrane. Are you allergic to any antibiotics?
Not as far as I know.
Okay, so no allergies to antibiotics. We can try some amoxicillin for 7 days, 3 times per day, 250 milligrams. Okay.
Thank you.
Let me go ahead and take a look in the other ear as well. Okay, checking the outside of the ear first. No discharge, no redness. And I'm going to take a peek inside. Pearly gray tympanic membrane and no infection. Okay, I'm gonna set this aside. And let's go ahead and check out your eyes. Okay. Can you look up for me? I'm gonna pull slightly on them and check the sclera. Okay, look down. Good. Good. And now look into the distance. I'm gonna check the pupil contraction and dilation. Good. And now look at my nose. I'm gonna check for that direct and consensual response. Okay. Right here. Good. Perfect. And I'm also going to measure your pupil. Look at my nose. 2.5. Look at my nose. 2.5. Okay. Go ahead and cover one eye. And look at the light. Now at my nose. At the light, my nose. Good. And now cover the other eye. Look at the light and my nose. The light, my nose. Good. And now leave both of your eyes uncovered and try to keep your head steady and just follow the light. Good. Checking for the eye mobility and the peripheral vision. Any pain here?
No.
Okay, I'm going to move it all the way to the other side and stretch out the muscles. Any pain here?
A little bit.
Okay. Pain here?
No.
Pain here? So just on the median, lateral end. All right. And now I'm going to bring the light close to your nose. Try to follow it as much as you can. Good synchronized movement. Perfect. Okay, so a little bit of eye pain on your right eye. Any double vision while I was moving the light from one end to the other?
No.
Okay.
My eyes do feel a little bit watery right now. Just a little bit. My vision's okay.
And on a scale of 1 to 10, how painful was that?
On the side, like a 4. 4 or 5.
Okay. Go ahead and close your eyes. I'm going to try to open them. Don't let me do that. So resist that. Good. And now puff out your cheeks. Don't let me unpuff them. Good. Perfect. And try to touch my fingers here with your tongue inside. Good. And here. Good. And now try to raise your eyebrows and then lower them. Perfect. Okay. I'm gonna go ahead and check the optic nerve. So taking a look at the back of the eye. Check the health of the cornea. Okay, you can look into the distance and just keep your eyes open. Perfect. Good. Okay, I'm going to take a look at your left eye as well. Okay, look up, look down, left and right. Good ratio, optic nerve is intact. No concerns. I'm going to set this aside. So I have here a Snellen chart. I would like you to hold it with your left hand and move it away from you as much as you possibly can, right? And now with both of your eyes uncovered, read me this top letter.
E.
Okay. And do you see the bottom line here?
Yes.
Can you read it from left to right?
L, T, F, P, H.
Good. And now can you please cover your right eye with your right hand and read that bottom line for me backwards.
H, P, F, T, L.
Good. And now can you read the third line from the top backwards?
H, P, F.
Good. And what color is this?
Green.
And is bubble number 3 bigger or bubble number 4 bigger?
Bubble number 4.
All right. And now can you hold this with your right arm and cover your left eye? And let's read this top letter here.
E.
Good. And the bottom line again from left to right this time.
L, T, F, P, H.
What color is this?
Red.
And is bubble number 2 bigger or bubble number 6?
Bubble number 6.
Okay. And what letter am I pointing to now?
F.
Good. Perfect. So 20/20 vision. I am not concerned with that. Not sure yet what the pain in the eye is about, but vision is 20/20. Can you press on your right eye for me? Is that painful?
No, it's okay.
Let's go ahead and do a couple of hearing tests. Keep your eyes closed, and I'm going to make a sound either next to your right ear or your left one. So go ahead and say right or left. Okay.
Left. Right. Left. Right. Both.
Yes.
Left. Right.
Okay. Next up, I'm going to check your dermatomes, and I have here a spiky object. It's not too sharp, so it's not going to penetrate the skin. It's just going to give you a very sharp sensation, and a soft object. So keep your eyes closed and say sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. dull, sharp, dull, dull, dull.
Okay, very well. And now I'm going to touch you with the spatula here, and I want you to keep the eyes closed and tell me when you stop feeling it. So just say now when you don't feel it anymore.
Mm-hmm. Now.
Good.
Now.
Good. And was that sensation about the same on both of your arms?
Yes.
Okay. I'm gonna do the face next.
Now. 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 Now.
Good. And was that sensation about the same?
It was colder on my left side.
Colder on your left side. Can you point to where you felt it the coldest?
More so on my cheek. I noticed it more on my cheek.
Okay. Interesting. Okay, let's do another test. And now I'm going to touch you with something either wet or cold.
Okay.
So go ahead and keep your eyes closed.
Wet. Cold. Cold. Wet. 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 Cold. Wet. Wet. Wet.
Okay, so a little bit of mixing of sensations of wet and cold on your left cheek. So we may have some loss of sensitivity there, or rather dermatome damagement. Maybe some nerve damage. We'll have to investigate further. Okay. So I made a note of that. I'm going to give you something to smell, and I want you to tell me what it smells like.
It's like rosy.
Rosy, very good. And now I want you to cover one of your nostrils. And let's try this smell.
That's minty.
Okay. So this was supposed to be lavender rather than minty. Okay. Now I'm going to give you something to taste. Let's see if you can identify the taste. Go ahead and stick out your tongue.
Citrusy.
Okay, that is correct. And go ahead and keep your eyes closed, and I'm going to spray you with a very fine mist of water. And I want you to try to point with your right hand where I'm spraying you. Good. 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 Very well. couple of notes of that. So abdomen, arms, neck dermatomes are normal. No nerve damage. Just concerned a little about the left side of the cheek. I'm gonna start off by checking the circumference of your head. $53. Good. And let's check your arms. 22. Okay, 22. So that's symmetric. And to your abdomen across. I did not have the centimeter side. There we go. That's exactly 90. Okay, good. And let's check the symmetry of your arms. Can you elevate them like this, parallel to the ground? Okay, 67. And okay, about 67 and a half. Good. Wonderful. You can lower them now. All right, go ahead and lay down. And I'm going to take a look at your abdomen, legs and feet. Okay. Okay, Anastasia. Are you comfortable?
Yes.
All right, I'm going to begin by doing a visual inspection of your abdomen. And belly button. Is it okay if I lift up your shirt a little bit?
Yes, of course.
Checking how the skin reacts to a light touch, the level of blood flow, and the temperature. Okay, normal activity is heard. Okay, pressing down on your belly button. Any pain there?
No.
I'm going to check the skin for reaction to touch and check for any elevations. Okay, I'm seeing one mole, which is slightly raised. And where do you usually feel the pain?
Usually in like when I have a stomach ache, sometimes it's like in the middle.
Okay, so right here?
Like below the belly button.
Below the belly button. Okay. Checking for any abnormal colors, indentations. No discharge from the belly button and no redness. Checking the activity in the abdominal cavity. Switching to the bell sound for the more superficial sounds and the top layer of the dermis. Okay. So I'm hearing activity in all 4 quadrants. No swooshing sounds. Good. I'm gonna check your aorta. It's normal. Good. Gonna do a light percussion. Resonance sounds are normal, symmetric. I'm going to take a couple of measurements. Normal level of symmetry is present. I'm going to go ahead and cause a vibration. Do you feel this? Mm-hmm. Okay. Go ahead and say now when you don't feel it anymore.
Okay. Now. No.
Good.
No. No.
Good.
No.
And I'm going to place it on top of the belly button. Do that again.
No.
Good.
No.
Wonderful. And now we're going to do the wet or cold test.
Cold. Wet. Cold. Cold. Wet. 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 Cold. 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 Wet. Wet.
Do you feel this equally on both sides of your abdomen?
Yes.
How about this sensation about the skin?
Just the same. The same. The same.
Okay. How about now?
The same also. The same.
Very well. And sharp or dull?
Sharp.
Good.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Good. I'm going to do a light palpation and check for any masses, any lumps, and any tenderness.
Okay.
Checking the spleen underneath your left rib cage. And the tip of the liver on the right side. Go ahead and slightly raise your knee here, bend it, good, so that there's no tension in the muscle. I'm able to palpate the tip of the liver and I can barely feel it, which is normal. Okay, you can lower your foot here. And checking the size of your stomach. Normal. And pressing down on your kidneys. Any pain there?
No.
Okay, no pain. Wonderful. I'm gonna go ahead and check your legs next and your feet.
Thank you.
Alright, let's take a look at your legs and your feet.
Okay.
Just doing a visual inspection first. Okay. Checking for any visual signs of abnormalities, such as skin conditions or edema. Nails are not clubbing, no pitting is present. Can you wiggle the toes for me? Good. Normal level of mobility there. I'm gonna check your pulse. Pedal pulses first. 2+ synchronized, and the popliteal pulse by the knees. Good. Normal. Feet are getting colder towards your toes here. Is that normal for you?
Yes, it's been like that my whole life.
Can you push into my hands with your pads? Good. So, how about with your heels? Wonderful. And can you elevate your feet one at a time. Perfect. Okay. So you have good strength there. Alright, I'm going to go ahead and tap. And I'm going to check your patella first. Any pain there?
No.
Any pain there?
No.
Okay. And your ankles? Any pain there?
Not there, but my left ankle is a little bit sprained right now. It's just slightly from playing tennis the other day.
Okay, let me go ahead and palpate it and see if I feel any inflammation. So I'm not feeling anything that's abnormal. No, nothing is. I'm not feeling anything abnormal, so nothing is swollen. Okay, taking a look at the plantar region and the toes. Any pain there?
No.
Okay, any pain there? Good. I'm gonna do the Babinski test. Good. Good. All right. Now, can you tell me if I'm touching you on your right foot or your left one?
Right. Left. Right. Left. Right. Left.
Good. And is this sharp or wet?
Sharp. Wet. Wet. Sharp. Wet. Sharp. Wet. Sharp. Wet. Sharp.
Very well. I'm going to take some measurements. 22 and 21 and a half. Close enough. 26. Good. So normal symmetry is present. All right. Anastasia, this concludes the exam. I did a very thorough head-to-toe assessment for you today. I'm not able to find anything abnormal other than the ear infection. So we're going to go ahead and treat that with some amoxicillin. And let's go ahead and monitor your symptoms. So I'd recommend that you come back in a month and then we do another follow-up.
Okay, sounds good. Thank
All right.
you.
Do you have any questions for me today?
No.
No. All right. So I'm going to go ahead and then send your prescription to the pharmacy on file.
Perfect. Thank you so much.
Thank you for coming in today.